I'm very honored to be part of this lunch. I want to say a very big thank you to the Sick Kids Foundation who have decided to support the community outreach screening program. I think it's very necessary. More often than not, we call for people to come to the hospitals and health centers to do the screening. Some way, somehow, they might not even know what challenge they have. Like we all know, some believe it's spiritual, others, it's a curse, others, it's something else. And so they don't really go to the hospitals to screen. So taking the screening exercise to them in the communities is very laudable. And that is the more reason why I'm here to support that agenda by the Sick Kids Foundation. One other thing I noticed, which was the role play they acted, which I believe will serve a very good community drama series in the communities. Because more often than not, words don't really resonate with people. But when they see action, when they see the words being acted out, it gets stuck in their memories. They tend to relate more to it. So I adopted to fund the community drama series in the communities. So we get people aware, we create more awareness, for people to want to step out to go screen. Just so when the people hear that the screening service have arrived in this area, they all, troop in their numbers to go and screen, get their children to screen, just so we get to know exactly what it is that they are suffering. Sometimes they may not necessarily be sickle cell, patients, but they may be AS. Once they know that, it will inform them to be very cautious of the choice of partners they make, just so they don't end up having children who will suffer sickle cell. So I decided I'm going to support that initiative of it, just so we are able to get more people to get understanding of what sickle cell is, just to correct all the myths and the misconceptions, just so people are able to freely come out to screen and then also advocate for the kind of help or support that they require, just so they can keep, better. We've been told that the August comedian KSM have been living with it. It's an example of a very successful, sickle cell, patient who have lived with it and still live healthy. That only means that everybody else who suffers it can live with it and live healthy. You just have to identify the lifestyles that we need to adopt and those that we need to shed off. So together we can build a healthy society. Someone suffering sickle cell is just as normal as any other person. And so they should not be stigmatized. Sickle cell is not contagious, and so people should not necessarily, be relegated because they have it. And I'm urging everybody to open up and show love to people like that, people who have sickle cell. Relate well to them, let them feel comfortable enough to come out and, seek one or other forms of help, just so they can live healthy and happily. To our children, first of all, don't feel stigmatized. Sickle cell is like any other disease, like malaria. It's like, you can seek help and get help. No one should tell you you may die by the age of 26. No, you will live and live long to your old age. Don't be deceived. There are programs to manage you, healthcare programs to manage the condition and make you live longer. What you have is not contagious, so it will not affect people around you. So feel free to mingle. And to others who live with sickle cell disease patients as well, or persons as well, should open up and feel free and live closely with them, because whatever they face will not affect you. It's a blood-borne disease. And so it is in their blood, and it is not contagious. Even if their blood touches you, you will not get it, because that is not the mode of transmission. It is genetical. By the time the child is born, if the parents have any of the SS or AS and SS genes, they may end up getting it. So feel free to relate to them. To our young ones who are gearing towards marriage, it is one thing you also need to be conscious of. Find out, get screening and find out what your condition is regarding your sickle. Once you know, it will inform the kind of partner you should choose. Just so, like I said earlier, you don't birth forth children who will end up suffering sickle cell. Once you know, there's a saying that knowledge is power. It will guide you. Parents, love your children. Don't be stigmatized by what probably others may have said about sickle cell. Don't neglect your children because they are said to be sickless or they keep falling ill one day or the other. Seek help for your children. There are conditions there are situations that will make your children live healthily. That all those challenges they may face in terms of health will be dealt with. As a parent, you carried your child 9 months in your womb. As a father, you managed to support your wife to keep that pregnancy. You, the parents, are the cause. Because whatever the child bears was born out of both of your genes. So love your children and know that it is because of you that they suffer what they have. And seek help. Take steps to seek help for your children. Show love to them so they live longer and serve the purpose for which they were brought on this earth. Don't neglect them. Don't abandon them because of what society may think or say. We are going to reach out to you and educate you on the way forward.